Experts say South Carolina is reaching crisis levels of dementia. An estimated 1 in 10 South Carolinians are believed to have Alzheimer's, and South Carolina's mortality rate is 8th highest in the entire nation.
Yeah, your State House reporter Mary Green explains why doctors, researchers, and advocates now have new hope for advancements and improvements.
2 years ago, the General Assembly allocated $10 million in the state budget that advocates say is now funding some of the most forward-thinking dementia research in South Carolina in decades.
We have seen more outreach to communities, more education to workforce, early detection and diagnosis of mild cognitive impairments in the earliest stages of the disease, and incredible biomarker research.
That money went toward the establishment of South Carolina's first Alzheimer's Disease Research Center, a collaboration between USC, MUSC, and Clemson. Its leaders provided lawmakers with an update into their efforts Tuesday. They include identifying hotspot counties for dementia in South Carolina, seeing how prevalent types of dementia differ from one place to another, and determining how much is related to genetics versus environment. They're also working to get more rural South Carolinians into clinical trials and trying to figure out why veterans are at a higher risk for developing cognitive impairment.
Veterans deserve our special attention to find out what's going on with them.
The researchers have been working for the last few years to get a federal designation that would be the first of its kind here in South Carolina. They say it would open even more doors for research and clinical trials, and that getting even more funding support for the state would go a long way toward that effort. Reporting from the State House, I'm Mary Green.
A big challenge facing South Carolina, a shortage of neurologists. The director of this research center says they're working to empower and educate primary care physicians on how they can help patients navigating Alzheimer's and other forms of dementia.